Stress is an inevitable part of life, a natural response to the demands and challenges we face. While a certain amount of stress can be motivating and help us cope with difficult situations, chronic stress can have serious consequences for our physical and mental health. Understanding the impact of stress on our well-being is crucial for managing it effectively and mitigating its harmful effects. The physiology of stress. Stress triggers a complex physiological response often referred to as the fight-or-flight reaction. When faced with a stressor, the body releases stress hormones like cortisol and adrenaline. These hormones prepare the body to respond by increasing heart rate, blood pressure, and energy levels. While this response can be beneficial in short bursts, prolonged activation can lead to a range of health issues. Physical health issues. 1. Cardiovascular problems. Chronic stress has been linked to various cardiovascular issues, including hypertension, high blood pressure, heart disease, and stroke. Stress causes the release of hormones that can lead to inflammation and damage to the blood vessels. Over time, this can contribute to the development of atherosclerosis, buildup of plaque in the arteries, increasing the risk of heart attacks and strokes. 2. Digestive disorders. The gastrointestinal system is highly sensitive to stress. Stress can exacerbate conditions like irritable bowel syndrome (IBS), ulcers, and acid reflux. It affects gut motility and increases stomach acid production, leading to symptoms such as abdominal pain, diarrhea, and constipation. 3. Weakened immune system. Chronic stress can impair the immune system's ability to function effectively. Stress hormones can suppress the production of immune cells, making the body more susceptible to infections and slowing down the healing process. This can lead to an increased frequency of illnesses and prolonged recovery times. Musculoskeletal problems. Stress often leads to muscle tension, particularly in the neck, shoulders, and back. This tension can cause or exacerbate musculoskeletal issues like tension, headaches, chronic pain, and even conditions like temporomandibular joint disorder (TMJ). 5. Weight issues. Stress can influence eating habits, leading to either weight gain or loss. Some individuals may experience stress-induced overeating, often seeking comfort in high-calorie, sugary foods. Conversely, others may lose their appetite and struggle to maintain a healthy weight. Both extremes can have detrimental effects on overall health. Mental health issues. 1. Anxiety disorders. Chronic stress is a significant risk factor for developing anxiety disorders. Prolonged exposure to stress can lead to persistent worry, nervousness, and panic attacks. Conditions such as generalized anxiety disorder (GAD), panic disorder, and social anxiety disorder are often exacerbated by ongoing stress. 2. Depression. Stress is closely linked to the development and exacerbation of depression. The constant pressure and feeling of being overwhelmed can lead to feelings of hopelessness and sadness. Stress can also disrupt sleep patterns, which is a significant factor in the onset and progression of depression. 3. Cognitive impairment. Chronic stress can impact cognitive functions such as memory, concentration, and decision-making. Stress hormones can affect the hippocampus, a brain region involved in memory formation and retrieval. This can lead to difficulties in learning new information and recalling past events. 4. Sleep disorders. Stress can significantly affect sleep quality. Individuals experiencing high levels of stress may suffer from insomnia, difficulty falling asleep, or frequent waking during the night. Poor sleep can further exacerbate stress and lead to a cycle of sleep disturbances and stress. Long-term effects and chronic conditions. Over time, the cumulative effects of chronic stress can lead to serious long-term health conditions. These include diabetes. Chronic stress can contribute to insulin resistance and increased blood sugar levels, raising the risk of type 2 diabetes. Cancer. While stress alone does not cause cancer, it can influence cancer progression and reduce the effectiveness of treatments by weakening the immune system. Managing and mitigating stress. Given the profound impact stress can have on health, effective stress management is crucial. Strategies for managing stress include: 1. Regular physical activity. Exercise is a powerful stress reliever. It helps to release endorphins, which are natural mood lifters, and can improve overall physical health. 2. Healthy diet. A balanced diet can help the body cope with stress better. Nutrient-rich foods can stabilize blood sugar levels and support overall well-being. 3. Mindfulness and relaxation techniques. Practices such as mindfulness meditation, deep breathing exercises, and progressive muscle relaxation can help reduce stress and promote relaxation. 4. Social support. Connecting with friends, family, or support groups can provide emotional support and alleviate feelings of isolation. 5. Professional help. For chronic or severe stress, seeking help from a mental health professional, such as a therapist or counselor, can be beneficial. Cognitive behavioral therapy, CBT, and other therapeutic approaches can help individuals develop effective coping strategies. Improving time management skills can reduce stress by helping individuals manage their responsibilities and avoid feeling overwhelmed. 6. Time management, reducing stress through organization. Effective time management is a cornerstone of stress reduction. By organizing tasks and managing time wisely, individuals can avoid the overwhelming feeling of being constantly behind. Here's a deeper look into how time management can alleviate stress and practical strategies to enhance it. A. Prioritization. The Eisenhower Matrix. This tool helps prioritize tasks based on urgency and importance. Tasks are categorized into 4 quadrants: urgent and important, important but not urgent, urgent but not important, and neither urgent nor important. This system helps focus on what truly matters and reduces the tendency to get bogged down by less critical tasks. The 80-20 rule, also known as the Pareto principle, this rule states that 80% of results come from 20% of efforts. Identifying and focusing on the most impactful tasks can lead to more efficient work and reduced stress. B. Setting realistic goals. SMART goals. Goals should be specific, measurable, achievable, relevant, and time-bound. Setting SMART goals helps in breaking down larger tasks into manageable steps, reducing the feeling of being overwhelmed. C. Creating a schedule. Daily and weekly planning. Use planners or digital tools to organize tasks and deadlines. Scheduling breaks and leisure activities alongside work tasks ensures a balanced approach and prevents burnout. Time blocking. Allocate specific blocks of time to different tasks or activities. This method can improve focus and productivity as it reduces the tendency to multitask and helps maintain concentration on one task at a time. D. Avoiding procrastination. The Pomodoro technique. This technique involves working in short, focused intervals, usually 25 minutes, followed by a brief break. It can help maintain motivation and prevent fatigue. Task chunking. Breaking tasks into smaller, more manageable pieces can make them seem less daunting and easier to start. E. Learning to say no. Setting boundaries. It's important to recognize personal limits and avoid overcommitting. Politely declining additional responsibilities when already overloaded can prevent added stress. F. Delegation. Sharing responsibilities in both professional and personal settings. Delegating tasks to others can reduce individual workload and stress. Effective delegation involves clear communication and trust in others' abilities.